My name's Jon Wilks. For those of you who don't know me, I have the privilege of being Chief Executive of the Institute of Health and Social Care Management. And we're joined today by Jon Glynn, who's Chairman of this Retired Members Special Interest Group, and the one and only David Trigger, who's a very enthusiastic supporter of this group. This group is the Retired Members Special Interest Group. On our books within the Institute, we have several hundred people who are either retired or probably approaching retirement. Many have been members of the Institute for a number of years. They probably sat the old diploma exams that the Institute ran in the 80s and 90s in particular. And this group really is a means of just uniting people in common purpose who may be retired or approaching retirement and who'd like to stay in touch with friends, colleagues, the networks that the NHS and social care provided them with during their career, and can also aim to provide them with as a support mechanism during their retirement. So today we're going to be talking about volunteers and the importance of volunteering and how one gets involved in volunteering. I thought, Jon, first of all, Jon Glynn, you might like to start us off by talking about your own experiences when you were working in the NHS. I know that you were in legal services and so on, but yes, you know, no trust can operate without volunteers within it. I think that today I can't imagine that actually any social care provider could probably operate successfully without volunteers in it. But just give us, first of all, your own impression of the importance that you might attach to the volunteers.
Well, talk about volunteers in general, I guess. It's been a really important thing. Volunteering, in two respects, volunteering is giving, but it's also something you receive. It's a two-way process, very much. Obviously, the beneficiaries of volunteers are the people who benefit, but also you as a volunteer yourself get lots of benefits. I never thought of myself. I work, just stepping back a second, I worked for 40 years and a day in the NHS in East Cheshire in Macclesfield. I never thought of myself as a volunteer. I didn't see it as a very well paid career, but I did actually thinking of it for today. I actually organised lots of things, and that was volunteering in its own way. My particular interest is walking and hiking, and so I was able to organise. There was a total of 30 walks for trust staff, and they turned out to be so good because people from every level in the organisation were able to attend. We got people from trust board members and consultant level clinicians, both and contract staff. So we had a 56-seater coach, which was used during the week for transporting nurses for training somewhere. And I was able to collar the bus for the weekend. And so we could go anywhere from the Lake District to Wales or anywhere. So that helped in lots of respects. It got people together to talk who wouldn't normally speak together at all, to stop in the place wherever we'd set up for a meal at the end of the thing. So that was my bit of volunteering. But of course, in legal services, I also had volunteers. Access to health records was something that came under my remit. And so we had good volunteers, well-vetted volunteers, who were doing all the boring tasks, if you like, but doing them well and very usefully, of photocopying case notes and work that other people wouldn't particularly want to do, but it was beneficial to the NHS. I'd really like to hand on to Dave Trigger, who's a proper volunteer, if you like, and then I'll be happy to talk about issues as they come up, and hopefully we'll get some conversation going out of them. So welcome to you, Dave.
That's fine, Jon. That's fine. Thank you. And Dave, good to have you along. Can we just to build on what Jon was talking about? What, for people who've not done a huge amount of volunteering in the past, but they realise they're going to have a bit of time on their hands during retirement, what sort of a mindset do you think you need to adopt? Do you think you need to necessarily go into something that you are expert at, or just something that you think you might enjoy? Could you just try to talk to us about that, first of all?
Is this you, David?
I think Dave has. Oh, there we are. We've got you again, David. You're just frozen on us. Did you hear my question?
No, I didn't. Sorry.
Okay. So what I was asking was, talk to us about the mindset that somebody who's approaching retirement and is considering what they're going to do with the time they may have available. What sort of mindset do they have in terms of their approach to volunteering? Should they be volunteering on something that they've got some expertise at? Or is it more important just to be able to think, free your mind and give some time and effort?
I think the important thing is to decide exactly what it is you want out of volunteering to start with. I started as a volunteer when I was a Boy Scout. So I'm going back to when Queen Victoria was on the throne, and I learned a lot through the Scouts. When I left the Scouts, I then joined the Army as a territorial, and I served for over 25 years in the Army as well, with the Territorial Army and on attachment to the regular Army as well. My NHS career started in 1960. I know I only look 22, but I've been around a long time. My appearance is deceptive. And I trained as a surveyor with the Architects Department at Birmingham Regional Hospital Board. That again tells you how old I am. Hospital boards have now gone by the wayside with Andrew Lansley and so on. And then I moved on to other things, and I ended up as a international sales manager for British Aerospace, traveling all over the world. But the important thing about volunteering is that I didn't want to follow my father. My father worked until he was 65. He didn't have any outside interests. His main interest was looking after my mother. And 3 years later, he died. And I didn't want to follow in his footsteps at all. So I made it part of my life to get as many jobs as I could. I retired in 2006, and I went to live in Australia. I had 5 years with an old girlfriend in Australia, and then we parted company, and I came back to England. And when I came back to England, I looked out for volunteering jobs. The work that I've done over the years, I've worked with CQC on inspections of care homes and GP surgeries for...
Sorry to interrupt you, Dave.
Yeah.
Just because what we don't particularly need is a complete history of what you've done.
Okay.
Tell us about why you chose any of those things. In other words, because I'm anxious there'll be people on the call or watching on the recording who'll be interested on how you lay the ground to actually do useful, fulfilling volunteering. Help us understand what persuaded you to undertake, for example, your activity with the CQC or whatever. What fueled that?
Well, because I'd been with the NHS to start with, I'd had a background in dealing with buildings and so on with my surveying background. It suited my experience, suited the job. So I was able to bring something to it. And I think this is an important aspect of volunteering.
But was it a job that you applied for? So
Yes.
Was the volunteering something that you applied for because you saw it somewhere?
Yes.
Where did you see it advertised?
I can't remember. Probably on the internet, because I spend a lot of time on the internet. But it followed on from other work that I'd done previously anyway, working with our local hospital trusts and so on. But the important part with this is finding jobs where you have an experience that's relevant to the job and you're able to contribute something in the way of experience. I've got a little handbook here, I'm not sure whether you can, it's probably back to front or something.
No, we can see it. That's fine.
It's the Men's Health Forum. The Men's Health Forum, www.menshealthforum, all one word, .org.uk. I'll put it on the chat later on. But they came up with the can-do approach. Can do, 5 letters. C, the C is connect, the A is get active, the N is notice, D is discover or learn, and the O is offer or can do. So can do, and these are the important parts I feel for anyone that's facing retirement. So they're so good that many health professionals now prescribe them. This is the way to tackle retirement, is to make sure you're just not sitting watching telly or doing the garden or whatever. You get involved, you get to meet people, you get out into the community. So if you don't want to stay with health-related things, have a look at things like the University of the Third Age. We have over 1,000 members in, I live in Evesham in Worcestershire. We have over 1,000 members in our U3A, all coming to join together for a community part of it, but they also come to lessons to learn how to drink wine and appreciate the qualities of wine. Jon will probably tell you more about that. The way that we approach living is the important part of retirement, I feel. So how do you want me to go on that? I can talk for hours on this, but
yeah, I'm again, sorry to repeat the point, but what I'm particularly interested in getting clear in people who are in the audience today is how they should go about putting themselves in a position where when they apply for volunteering roles, they know that it's something that's going to be fulfilling. They know they're going to have the right time available to them. You know, what sort of an audit does one do basically before one starts applying for stuff to make sure that it's going to be right for you? And then I'm going to come to Margaret, who's got her hand. Yeah. Do you want to have a go at that, Jon, Glynn?
Well, I've not been in that position because I've never actually applied. I've sort of got conned into being, not conn's the wrong word, but I've fallen into being a volunteer, if you like, for things. For instance, I'm a member of East Cheshire Ramblers. So next thing is the Ramblers say, Jon, can you be a walk leader for us? And so, oh yeah, okay, I'll have a go at that. So what my volunteering has been things that have fallen into because it's been appropriate. I was a member of the Institute of Healthcare Managers by that very difficult exam in 1996, which was making the institute very exclusive, but very difficult to join in the first place. And I think your approach now, where we can all come along, is much better. So I was a member, and then of course getting nearer to retirement, found out about how the IHSCM is now, and I was happy to, and I'm still happy and keen to be involved with this group. So I've fallen into things rather than perhaps David's more organised approach, if you like, but still been able to contribute, I hope, and at the same time get stuff back out of it. So I'd just like to hear what other people who are here today have done about volunteering, or if they've had any experiences or things you can share with us, really.
I'm going to come to Margaret first of all. Margaret's got her hand up. So Margaret, lovely to see you this morning. Thanks for joining in. Did you want to expand on the question that I just asked about how you kind of get yourself ready?
Well, I never thought I got involved in volunteering initially when I was working in the health service, and I was a manager of a rehabilitation centre at Roehampton, actually, at the time. And I was asked if I'd like to take over as a trustee. A doctor was doing it, and I was asked would I take over for this local charity. And I've always had the attitude that if somebody thinks you can do something, you try it out. You know, if you sort of just, you know, people see you sometimes better than you see yourself. So anyway, I did that, and I became chair of the charity quite soon, really. And that was in where I live now in Richmond. And I've been in, I mean, I retired in '96 when Queen Mary's Roehampton closed down for rebuilding slightly early. And then I had another role in consultancy and running a patient safety organisation for 10 years from the Royal Society of Medicine. But that's by the way, because that was you know, the paid professional job. But I then got, so it went on really, so it escalated. And I've always been a trustee of a charity since then, more than one. Now I'm a trustee of 4 charities.
Margaret, can I just interrupt? Give us an idea of how much time you devote, would you say, to your volunteering activity during?
Well, I'm more or less full time, to be honest. I'm one of the participators in life, and you just, you know, to be honest, if you put your toe in the water, because I have to, you know, over the years I've got people to put their toes in the water in volunteering, and I've said just take up an opportunity, however small, and it will escalate from there if you fit, you know, if you enjoy volunteering. I mean, the world's your oyster, to be quite honest. You know, I'm trustee of 2 national charities, Carers UK and the Centre for Ageing Better, which is was set up by Lord Filkin, actually, with a 50 million grant from the big lottery, as it was called then. But anyway, and Carers UK, because I was a carer for 20 years. And that is immediately sort of after I left Queen Mary's, my mum started to develop dementia, and then my husband later on. So I'm very much involved in carer issues. I run, I've been doing it for over 10 years now, a carers peer support group for carers of people with dementia through a local charity. I was a dementia champion, giving, you know, the Dementia Friends talks for quite a few years until the Alzheimer's Society changed the programme. And I'm also involved, but that's a paid consultancy role at the London School of Economics in social care research. So I'm involved with a number of projects there, either as a co-investigator or an advisor. But this is all escalated, that's what I'm saying, from very small beginnings. If you're a participator and active, there's loads and loads to do, and it's not difficult to get involved because people are looking for people. You know?
Right, so that's the bit that I want to get to, is how did you find these roles that you now have? Was it something that you were just asked to do by people who you knew?
Generally.
Or did you generally have to apply for stuff? You know, help us understand, you know,
I've occasionally, some years ago, when after I'd left the health service, I applied for a few roles, such as a trustee of various bodies. But on the whole, it's quite good to let it escalate, because one thing feeds off another. So I feel one role enriches another, and you find your talents really, or your, you know, what people see. I run a PPG, a chair of a health centre, patient participant. Oh, I was involved with patient and user involvement, you know, the national bodies, Link and whatever, for many years, and chaired it. But you just get picked up really, because we're very useful people if we've lived in the health service. You know, I was a nurse and then a general manager. and people just, you know, you'll be picked up. There won't be any shortage. Just do something you've got a connection with. If you're a member of a church or something, you know, there's always charities around that sort of environment. Or even I'm a member of the U3A, you know, or I also run the archives group at Queen Mary's, so I give talks on that. You know, the world's your oyster, really, if you've got good health. You know.
Thank you. I've got John, you've got your hand up. Would you like to go next?
Oh, yes, thank you, John. Well, I'd like to endorse everything everyone said, and so eloquently. I have to say I owe volunteering to my whole career choice. I had what was now called a gap year, or it was actually 6 months before I went to university. And I wanted to do VSO. You couldn't do VSO for less than a year, not unreasonably because of the expense. So I went to something called Community Service Volunteers. And I thought I'd be sent into some poverty-stricken part of the East End of London, or up for fighting difficulties in other parts of the country. I ended up at Henley-on-Thames for the summer, but working as an unpaid volunteer nursing auxiliary, as they call then. And it just opened my eyes. It opened my eyes as a youngster then in what being human was all about connectivity with others. But it certainly opened my eyes to the health service, and that itself really shaped my my career direction. Having come to the end of my working career, I retired about 10 years ago. I really missed the NHS, and I thought, well, how can I continue to use my skills in a voluntary capacity? And one thing I trained as before I retired was as an executive coach. And of course, you could do anything you want if you're not being paid. There are certain standards. You can join. I did the Southwest and what was Thames Valley coaching register, so it's accredited. But of course, you do this in an unpaid capacity. And that was a great way of keeping going with my skills, keeping in touch with what was going on in the health service. And of course, it was the beginning of the new technology, as Skype rather than Zoom in those days. But that was one way of doing it. But I thought about this topic, John, before joining, and I thought, well, there are two broad areas. There's health-related voluntary work, and there's deliberately non-health related. One of the most obvious health-related areas, and a couple of you already mentioned it, is not necessarily a choice, but it's that of being a carer. My wife hasn't been well in recent times. My elderly parents certainly weren't. And certainly as we approach retirement, I think we'll find in that phase of our life, sometimes those roles are going to be put upon us. Or in a happier position, many of my friends are grandparents and looking after unpaid caring for grandchildren. Again, is a voluntary work. It would cost a lot if it was paid for commercially, but it is one aspect. Another is our local trust, IHS Trust, which happens to be the Royal Devon and Exeter, is very keen to search for governors. And with the background that we retired members have, we're very well placed. I didn't go in that direction because I thought, this is actually going to take over your point earlier, John. It's so much of my life, and it's a bit more of the same. But for those who actually like that sort of work, I'm sure your local foundation trust would be delighted to receive applications. A formal planning application process, and it's done by voting. What I am, though, is one of 20,000 members of the foundation trust. And our foundation trust arrange various events and so on, really interesting talks. And that's a great way, again, of keeping in touch with the NHS. There are other organisations.
Can I just address, and it's quite important, I think, you know, people talk about trusteeships or governorships. You know, funnily enough, those words are self-descriptive. You know, they come with a responsibility. This is, and you should be well aware of the statutory responsibilities that you have as a trustee or a governor, in particularly in charities. You know, it's not just a thing without consequence, basically. Certainly, if you're going to do the job properly, I just think it's probably worth pointing that out to people who may be contemplating those things.
I think that's really good. No, it's absolutely right. You are in effect undertaking a contract of work. The fact you're not paid is not material. You still have those responsibilities. You get expenses, but you still have those responsibilities, and that's a really important point.
John, Glynn, did you want to make a quick point there? I think you wanted to come in.
Not necessarily, no.
Forgive me,
I do. It is a fact that you. Oh, sorry, I was probably just playing. This is another older person's thing. No, I think John's absolutely right. You have got commitments once you say that you're going to do something, even in a much more simple thing. If I'm a walk leader, as I said, for the Ramblers now, and the walk that I'm going to be leading will be advertised on the web. So I'm going to turn up on that come hell or high water and lead that walk because I've said I will, and other people are expecting me to be there. So yes, there is commitment with it for sure. I mean, I'm committed now. I want to be part of this group, so I'm always going to make myself available to this group. So I think John's experience, and it would be nice to hear from other people as well. Really,
just very briefly on the non.
Yes, do, John. Thank you.
Yeah, sorry, John. Yeah,
I pick up your precise point. And I'm glad you raised it because they're legal. There's moral and social obligations. They're legal obligations. I've just completed 3 frenetic years as a trustee of my local U3A. We mentioned the U3A. The University of Third Age, they don't like to call it this anymore, but it's a brilliant organisation for any of you who haven't come across it, because there's so many different interest groups. You can run these groups, you can participate in all sorts of interests, monthly meetings and so on. End of plug. The important thing, as a trustee, I was registered with the Charity Commission. There are certain obligations and responsibilities legally. You are covered by insurance, as you would be if you're on a board of a public organisation, in effect. But you're absolutely right, John. There are responsibilities, and you think carefully about that before you embark on it. But it's very fulfilling. It's very satisfying. I was the newsletter editor. I now run their website. And I run a couple of interest groups. So that in itself is a very good opportunity for people who are looking to ways of getting involved further. One other organisation I'd love to mention is Action for Happiness. I don't know if you come across this. I'll put the link in the box in a minute. This is a brilliant group because this actually gives you 10 keys to happier living, and part of that is giving your time, community and so on. And I've also become involved in that, and that's a charity because they organise various Zoom groups and others, and you can become a co-facilitator on that. I'll stop there, but I hope that's helpful, and there's lots of very exciting things you get involved in. But you've got to be careful it doesn't actually take over your whole life. One of the points.
That's what I was trying to refer to earlier with Margaret and so on, where she says she's basically a full-time volunteer across all the different activities that she's got. And I think it's probably, Dave, if I go back to Dave Trigger, Dave, it's probably sensible for you to do a kind of a little audit of what you want for your retirement. Do you want to be fully committed on a working day basis to any number of different causes and so on, or do you want to have a little bit of time for pootling about in your garden or allotment or seeing grandchildren or whatever else it might be? So it's important. I think I'm moved by what Jon Glynn says about, if you do volunteer for something, be certain you are making a commitment whereby other people are then going to be relying on your largesse and your generosity of spirit. It's not to be taken lightly once you have decided to commit to something. But Dave, what do you think? You've done lots more volunteering than I have at this.
I took the decision 3 or 4 years ago to concentrate very much on dementia and conditions of mental health. My grandson is on the spectrum, so I've seen it at first hand, and I just felt that's the way I wanted to go. And these days, my latest job, I haven't told you about this, John. My latest job, I am now chair of the Independent Advisory Group for West Mercia Police. So we look at how the police are interacting with people with a disability. In Worcestershire, we have 22% of the population have a disability. So it's a pretty good chance that at some stage the police are going to be handling people that have a disability, but they're not being trained on how to do it. And my trick for the day, I suppose, is how can we get the police to understand that my nephew that has cerebral palsy can't get out of his wheelchair. He needs to be assisted in everything that he does. You know, how are they going to even be able to arrest him, for example? It's a different world. On the mental health side of things, I'm involved with a couple of dementia action alliances. We only meet once a month, so it's only a couple of hours commitment, I suppose, with that one. And I'm also involved with a support group for the relatives of people with mental health. It's very much parents have got children that have got problems.
Let me ask if I made the same question of you, Dave, as I was asking of Margaret. How long do you devote to these activities?
I try to get as much as I can, John. I find that it's
satisfying.
It's satisfying. I'm contributing to society, and I'm making myself live a bit longer, I feel.
To say nothing of the interactions that you get as a result of that as well. Jon,
I am putting my finger up this time. Yeah, I think I think something we've learned already just in this short time is that volunteering can be something that you've got a lot of commitment to, like Dave and John and Margaret, or somebody who just puts a bit of time aside for volunteering, as I do myself, really, and then have the rest of my time to do whatever my life's all about. So I think that's something that people can actively consider. They can think, yes, I'll just do this thing, I'll run a folk club, I'll do whatever I'm going to do, I'm going to collect for the lifeboat service, I'm going to do something, and then the rest of the time they can get on with whatever else. I think, you know, the work of people who do it more or less full time is really very much appreciated, but doing a little bit as well can be contribute
just as valuable to people. Quite right. Yeah, I can see Ian. Hello, Ian. Lovely to have you with us. You've got your hand up. You'd like to make a comment. Hello.
Yes, thanks. If you hear a bark at my background, I've got two wide-tailed fox terriers trying to get me to do something I don't want to do.
I think we've met them before, Ian. I said
yes, that's right.
On a previous call with you.
I fell the other day there, and the boy thought I was having a game to play. He jumped on top of me off a wall. So he's no rescue dog, right? Yeah, I'm very interested in people experiences in volunteering. I've been a volunteer since retiring from my public service job, and this has included the setting up of a health watch in Greater Manchester and Wigan. And then in 2013, after doing 3 years there, I came back to Scotland with my wife following the death of my sister. And so my last surviving sister isn't on her own. But immediately we came here, there was a hell of a surprise for us in that we came to live in a very rural community in Highland Perthshire, and how much difference are the relationships in a community like we are now and in the urban community we were in Wigan. And it's not about people being better up here and those down there. The different lifestyle and the way you live. And we're connected with people up here on almost like a daily basis. And some of them, if they were in Wigan, very rarely we've spoken to them. And so we've built up with a group of friends with all different types of backgrounds and arrangements in different ways. but it's allowed us to get very quickly involved in community activities. And for example, this last fortnight, my wife has been running a pop-up shop in Aberfeldy, which I help with, and we've raising funds for gamekeepers whose families are left when they commit suicide or survive in a very bad way. We're not supporters of shooting any animal but these are, for us, are one-off lonely workers, paid low, have employers that most of them don't give a shit about them, to be perfectly frank. And so that's why you get in these areas people committing significantly for the numbers damage to themselves. But I'm now elected member of the Health and Social Care Partnerships in Scotland, and called Integrated Joint Boards, and I represent the community groups and the users of services in Perth and Kinross, and this takes up a considerable amount of our time. One, fighting the system, and in that they don't take too kindly to representatives of patients. It's a culture issue, and we've been campaigning.
You need to read Cunlay Thomas's book that's just come out. Cunlay is a long-term member of the Institute, and he's written a book all about the patient journey and the patient experience.
Oh, good. I will, thanks.
And he's doing a book session with us shortly, so you must tune into that. And if I may say, I was up in Edinburgh yesterday because we've just NHS Education for Scotland has just joined the Institute on an organisational basis as our country hub for Scotland, and I know they are looking for people like yourself who can give direct lived experience testimony of how the system needs to be amended, changed, improved, edited.
Yeah, well,
so maybe I can link you up in the future.
Yes, that would be good. I actually did a presentation in Edinburgh to a range of civil servants and local government social care, and the chairs and vice chairs of integrated joint boards across Scotland. And it was about the equality of access, the equality of resources, all the things that need to happen but don't. Ironically, Scotland disbars in law people like me having a vote on anything, or even moving a motion or resolution. And we've been campaigning at the moment on the continual loss of GP surgeries in local communities, rural communities. And we're literally on the brink, in my view, of seeing a quite significant crash in services being maintained in rural areas. It's just 15 years of non-investment coming home to roost. And we also do, I've got involved in a group that was set up long before I came, of retired people like ourselves meeting on a Wednesday morning and having breakfast. And we raise funds through that to Mary's Meals. And so far this year, this little group of us, we've raised nearly £3,000 so far. And it's a group. I think if I was asked to move a motion, I don't know if I'd have a seconder for it among the membership. But they're really good, nice people.
I just love the idea of you all meeting for breakfast, for whatever else it might be. At least it gets you out of bed, gets you out of the house.
Yes, exactly. It's a great breakfast, by the way.
Really idea.
And the attendance keeps going up. We keep getting new members.
I'm not surprised to hear it.
The one drawback I've got is we've come here to a very isolated area. But if I'd known before we purchased it where we were, I'd known that I had sleep apnea, I would have made a different decision. Yeah. Although I've got a bus pass in Scotland, you could never use it. The nearest bus stops 5 miles away. And so if you're going to walk to the bus stop, you might as well walk to the next village. But it all came about at the last minute. I had a show. Shut up. I had a shoulder operation. At the end of it, the anaesthetist said to me, "Do you know you got sleep apnea?" I said, "No." She said, "Well, you're lucky I voted for you at the last election. I've kept you alive for the last 45 minutes." And I came up here and she sent a letter up to my GP and everything. I ended up having to give my licence up. And when I turned 70, I got a letter from DVLA saying it was taken off for life because of the nature.
Tell me, Ian, up there within the rural sort of environment that you're in, do you have sort of volunteer drivers who take you to places? Is there a good scheme going on for you up there?
My wife is the scheme.
Right.
Although when we went to the Rotherham by-election the other day, I got picked up by a party member there and back again, and one of my neighbours comes to take me here. So I really wouldn't say I'm completely isolated, but I could be, and it's I would have made a different decision not to come back to Scotland, but probably a bit nearer a bus stop at least.
There we are. All right, I'm going to move on. Thank you for your enthusiasm and joining in today. You're a much valued member of the group and of the Institute, so thank you. It's worth pointing out, Jade has just put up in the chat there, for those of you interested, the details of the event with Kunle Thomas on the 26th of September. For those of you who are interested in patient work and working back from the patient and having proper testimony of patient experiences, it'll be a really good session. You will thoroughly enjoy that. And we did play a very modest role in promoting the book as well. So it's also worth mentioning that Margaret has put in the chat that Ian's mentioning community. Once one becomes a volunteer for an organisation, one becomes a member of that community. One doesn't think that one is volunteering. One is just a participator and member of that community, contributing as one is best as able. I think that's a really good observation, Margaret. And often, a lot of the stuff that you do get involved with, all it does is it just binds you into that community. And actually, you realise is, when you thought you were going to be a little bit more lonely when you were retiring because you didn't have the organisational workmates around you all of the time, actually, there's plenty of really nice people who are prepared to wrap you in their own love and relationships and so on to keep you going, when you're in the retirement environment. Yeah. John Hunt, you've got your hand up.
Well, yeah, just two things. I think, and something I talked to Jade about previously, and that is, there's an awful lot of things to be handed on to the youngsters from this group of people, I would say. And so, if there's any way that we can act as mentors, we were talking about, to the wider institute, I think there's a lot of benefit for them from.
Well, watch this space on that, John, because Jade and I are designing a new mentoring scheme. Jade is leading on that. We have a lot of people who've been through our mentoring short course masterclass within the Institute who've expressed a desire to actually then offer mentoring to members, and people like yourselves wishing to volunteer as well. So do keep a lookout. That is something that we are determined to make happen fairly shortly.
Thank you. The second thing I'd like to hear from Colin and Tony, and Colin's I know in Cyprus. And
I'll get to them. I've got John Hunt with his hand up first, though.
Right. Thank you so much. Thank you. I just really want to endorse exactly what Margaret had said. I found, I'm sure others find, that if you do volunteer or get volunteered for something, you're automatically in this community of people, community of interest. And there's a real sense of belonging and I think a real sense of contribution. The one thing I just wanted to say very quickly is I put the links in to Actual Happiness and indeed the National Youth 3A website. Each local organisation has its own website. But I've also, one of my sort of professional hobbies, volunteers as it were, is I've kept a Leadership Online website going. And I have put on, really in preparation for today, an extra blog, as it were, in the About section, which is all about dealing with retirement. And what I've put there, and this is useful to anyone of any age, you may have heard of this, is not just the Action for Happiness tool, but also the Wheel of Life tool. And I don't know if any of you come across this, but it's a really useful tool to just step back and evaluate your work and your life as a whole. And I won't go into detail, you can have a look at it in your own time. Lots of stuff on websites on that, but it's really good. You can change your criteria, but you do actually take an opportunity to assess either yourself or with a coach where you're at and where you want to go. And it's a really useful tool throughout one's career as well, I'm finding, is in retirement.
Thank you, John. Tony, Fenn and Colin Pearson, hello to both of you, stalwarts of the retired group and stalwarts of the Institute of Health and Social Care Management as well. Tony or Colin, any reminiscences or observations or opinions about your own volunteering activities?
Well, I retired from the NHS in 2001 and then started another job in September 2001. And I retired from that 5 years ago. And I haven't particularly done what I would call volunteering, but what I have done is become very involved with a very left-wing political organisation and starting to try and inform them about the issues and disasters we have around economics, the environment, energy, and the fact that we are heading for, how shall we put it, no living things on Earth if we're not careful. And that takes a lot of reading, a lot of researching, and a huge amount of trying to convince them that they are accurate statements. Because the myths that are being promulgated by the mainstream media and the politicians and the fossil fuel companies and their supporters and the financial system who are currently benefiting have been there for decades and are very difficult to overcome and to get people to understand, including the IHSM, because the health services ain't going to exist if we don't do something correct.
Well, I know how, to be fair, I know how hard you work at your own research activity. I know how widely read you are, and I know how seriously you take it. And it's always interesting hearing your views. I think we've had you talking about economics, I think in this group before now, and it's not for everybody to agree, but at least you are well informed enough to be able to have a sensible dialogue and discussion about it. And we
still have a government that doesn't admit can spend what it needs to.
Well, okay, we're not going to go there today, Tony. But the lovely thing is that the lovely thing with you is that there's no denying your genuine interest in the topic that you discuss, and I applaud it. I love it. I love it. Colin, what about you?
Right, I have to confess I've only just recently sort of retired. The consultants work abroad don't ever seem to retire. So I've only had one period where I volunteered. When I finished working in the south, I went to see the Minister of Health in the north, and he assigned me to work with the chief executive as a urologist in the North Cyprus Hospital in Nicosia. And I worked there for about 6 months on a part-time basis. Have to say, languages is not my forte, and really not being able to speak Turkish proved to be a problem. But I did get one particular benefit. He assigned me a young doctor as an interpreter, and she turned out to be trained as a physician in the UK, and she's now my GP. So given the scope for getting access to medical care, I think that was a bonus. There are quite a lot of activities you can do here on a voluntary basis.
It's worth mentioning for those that you don't know that Colin lives in northern Cyprus these days. Some people may not have known that, Colin. So.
Right, sorry, yes. Okay. Yeah, anyway, there are quite a lot of associations, and there's a big campaign by the British Residents Association to get the British government to recognise North Cyprus. So you can get involved down that political line if you want to go that way. But there are also, North Cyprus has one of the highest levels of cancer probably to do with the what they spray on the vegetables and fruit here. And so there are a lot of charities that are run quite a lot by Brits to help there. So those are other options. But we're about to be invaded by Russians buying up a large section of the east end of the island. And so that probably changed the flavour, but I've no idea what sort of voluntary organisations they do. So thank you.
AGB.
Thank you, Colin. Tony, you've got your hand up again.
Yeah, just another comment about my second job, which was about auditing quality management systems in healthcare.
Ooh.
Internationally. Boy, didn't you learn how the NHS is incapable of learning.
Well, tomorrow we've got a session on how do you do quality improvement. I think it's at 12 noon. I bet Jade within the next nanosecond will have the link. But if you do want to come along and have an alternative view of how you might manage quality improvement.
Well, you need to abolish a CQC for a start.
Well, let's. You know that I'm no huge fan. I know we've got David. You know I'm a fan of the people who work in the CQC.
Some of them.
I'm not a fan of the inspection process that is.
It's changed, John. We've got a new process now.
Really? Okay. Yeah. Well, I look forward to hearing more about that, David. If you want to join us at noon tomorrow, you are very, very welcome indeed.
Okay, thank you.
And you can volunteer for CQC by joining their Citizen Lab, where they seek opinions on the way that they carry out their inspections. So if you feel very strongly about it, John, I suggest you join Citizen Lab.
I'm not sure they're ready for me, or Tony for that matter right now.
But as an example of what I mean, in the UK, we assessed UK hospitals and they'd merged with other hospitals 10 or 15 years ago, and the staff still talked about being members of the hospital. Mm. We went into Portugal and they merged 6 hospitals. 18 months later, every member of staff was saying they were a member of the overarching organisation.
Mm.
Interesting.
It's cultural and senior level.
Yeah, absolutely. Absolutely so.
It's the same up here on health and social care.
Well, Ian, it's a work in progress. Now I've been to Edinburgh and heard from them what they're trying to do and how we might help them. You know, stay tuned. Stay tuned. Anything's possible.
Well, I hope they start telling us.
I'll make sure I tell you, Ian. Don't you worry.
Yeah.
All right. Look, we've got about 4 minutes left. So, has anybody got anything else they might like to throw in terms of this volunteering topic? That's been a really
the essential message is that volunteering is good for you. You get benefit both ways, as John said right at the beginning. It's a two-way street. You can gain from as well as giving.
Yeah. Brilliant. All right.
We need more volunteers, particularly in the NHS, because they can't afford to pay us. And I've just read on the news that Birmingham City Council has just gone bankrupt. Yeah, so don't go to
I mean, it's an impossibility if you have county and city councils responsible for local authorities responsible for delivering social care, and so many of them are now basically financially strapped, bankrupt, whatever. You know, where do you go from there? You know, it's just a downward spiral of doom, I fear.
Yeah.
Anyway, look, that's it. Let's call it that for today. John Glynn, as our chair, would you like to round up?
Well, I just would say just how interesting this little meeting has been. Really, the contrast about the people within it and the things that they do are just amazing. From myself, who does very little, to people who do devote their life to the thing, to volunteering. I think it's all amazing. And just a shame there couldn't be lots more people listening to this, because
there'll be a few on catch up. There'll be plenty on catch up, John. Don't you worry. So
good. I'd just like to thank everybody who's spoken today. I just thought it was excellent, and that we can continue to develop the retired members, group. If we've got people like this coming along to it, that's great. Thanks.
Lovely. Well, look, it says Jade has just put up in the chat. You can see it for yourselves. Next meeting of this group is the 24th of October, and we are planning to host 5 workshops as part of the first IHSCM retirement conference. If you'd like to contribute about anything, whatever you'd like to discuss or present or join in a panel session, whatever it might be, do please contact Jade. She'll be only too happy to hear from you. All right. Thanks, everybody.